Well, welcome everyone. Before we get into our discussions today, I want to play a short video on behalf of our webinar sponsor, Aflac.
Saxon and Sawyer are two peas in a pod. They were born together. They were roommates. Sawyer was literally born with his cure. When they informed me that Sawyer had sickle cell anemia SS, I was devastated. I was at a loss for words. And his doctor was like, I know it's hard, just trust me on this. The best thing for us to do is to get him the best care, which is how we came into the hands of Children's Healthcare of Atlanta at the Aflac Cancer and Blood Disorder Center. Saxon was Sawyer's bone marrow transplant donor, and he went through the surgery and the procedure with his brother. The level of care that my son received at this hospital, it's hard to describe. It means so much to me, their family. When I see the nurses that took care of my son's team of doctors, my heart and my smile and my mind, everything lights up. My son is here and he's walking around with a beautiful, bright smile because of this hospital and the care that was given by the team here at Aflac.
Emojis! Emojis! Can I see them?
Sawyer and Saxon actually received my special Aflac ducks. And Sawyer named his duck Daxton after his twin brother. I am in love and in awe with everything about the Aflac duck. It helps to give the kids a way to express themselves.
He's happy! Yay!
It's a wonderful tool. And I think the more patients that have the opportunity to be able to use it, I think it would help them tremendously.
It's stories like Sawyer's. They're the reason we're so excited to launch My Special Aflac Duck early in 2022 for children with sickle cell disease. We believe it will make a difference in bringing comfort and joy to them with medical accessories and an app designed specifically to meet their needs.
Well, welcome all. I am Michael Morella, managing editor of events at US News and World Report, and we're here today to talk about sickle cell disease. We're going to explore the opportunities and the challenges that surround this condition. Today's event is the latest session in our ongoing Healthcare of Tomorrow series. I encourage you to explore future webinars, watch videos of past events, and sign up for email updates at usnews.com/healthcare of tomorrow. Before we get started, I just want to alert you that we are capturing video of today's session, and we'll be making that available to registrants after we conclude. We are also simulcasting on the US News Facebook page. Later on in the webinar, if you have questions, we encourage you to please type them into the Q&A feature in Zoom on your screen. Our team will review and try to give voice to some of them as we have time. So now I am pleased to introduce our first panel. With us today are Audrey Boone-Tillman, Executive Vice President and General Counsel of Aflac, Aaron Horowitz, co-founder and CEO of Sproutel, and Shay Guillory, the mom you just saw in that video, and the founder and CEO of Sawyer's Sickle Circle. Welcome all. Thank you so much for being with us.
Thank you, Michael.
Thank you for having us.
Thank you.
Shay, I'd like to start with you and first say thank you. Thanks for sharing your story and your family's journey with sickle cell. Is there anything else you want to share quickly, about what you've learned or your son's care with the audience?
Yes, it's very important for me to be able to share our family story. I kept our story very hush-hush until after our process was completed. I did it that way simply because I wanted everyone to be able to see the beauty in what was the ending of our story. It was a beautiful experience with the care and the help of our physicians and the team and the Aflac duck. It was amazing. Sawyer had the best healthcare and the healthcare providers that I could pray and hope for. I'm so happy and grateful for every experience that we had in coming and getting over our issues that we had with sickle cell.
Great. Well, Audrey, can you talk to us about, the why and the how? Why is AFLAC committed to sickle cell disease, and how is that commitment manifesting itself?
Yes, Michael, for 26 years, AFLAC has been shining the light on pediatric cancer and blood disorder services, which includes sickle cell. So we've been in this fight for a while now. And I always like to mention, because the cancer center portion of the hospital gets so much time and attention, and rightly so. But that blood disorder services portion of the hospital is critical to so many people and so many families, like Shay's beautiful family. That portion of the hospital is the largest research and treatment facility for sickle cell in the country, perhaps even in the world. And so much has taken place to advance the cause of sickle cell by the work that AFLAC has invested in for the last 26 years. And research has shown that sickle cell is a chronic disease that is underfunded and lacks the visibility that a lot of chronic diseases have. So we want to do our part. AFLAC's a very purpose-driven corporation, and knowing the light that needs to be shown on this dreadful disease, we want to do our part to bring awareness, as well as the $154 million that's been donated through AFLAC, the company, through our sales associates, and through our employees for the last 26 years.
Erin, in a lot of ways, you work on the physical manifestation or a physical manifestation of this work. My special AFLAC dog, you've got it right there. Can you talk a little bit about the research that went into the development of this? I think our audience would love to understand what you've learned in trying this out with families and at the clinical level.
Absolutely. So, when we set out to design something for families with sickle cell disease, we started by listening. We conducted countless interviews. That's how we met Shay and learned about Saxton and Sawyer and their incredible story, and with doctors. And we learned about all of these challenges, the challenges of pain crises, these moments of stabbing pain that are just so challenging for families and leave really everybody feeling helpless. We learned about the challenges of maintaining a daily routine, of taking medication, of staying hydrated, eating healthy, remembering to bundle up because these rapid temperature changes can cause pain crises, and taking breaks. And so we really thought, as we set out to design something specifically for families with sickle cell disease, we thought about how we can create a friend that's just like them, that helps them not feel alone. But really, this duck isn't treatment. So we thought about how we can help them cope in the home, because these pain crises can be so challenging, and how we help build and really reinforce those routines through positive play, through things that are fun.
Shay, you spoke briefly about this in the video, but you've had some very firsthand interaction in this way, you and your family. Can you talk a little bit about that, and how Sawyer has used and responded to this?
Yes, absolutely. So as Erin spoke, both of my sons have the duck, and they love them. They named them Daxton and Lucky affectionately. They call them emojis. So they have these emotions that my sons are able to respond and tell me how they're feeling by expressing their emotions through the ducks. And I think that's amazing, simply because my sons were very young when Sawyer went through his bone marrow transplant. And so for children that may not be able to speak or are introverts and cannot or may not know how to get across how they're feeling, being able to grab something like that's something that's smiling or frowning or doesn't feel well, and touch it to the duck, it allows the parent to explore that more. Well, is your duck sick? Is your duck sad? Are you also sad? Are you not having a bad day? It allows the conversation to be opened more between the parent and the child. And I think that's a great way of communicating, especially in times when your child is not feeling well.
And we also found that with my special AFLAC duck for the pediatric cancer patients, it gives the child a sense that they're not in it by themselves, that they're in it with their friend. And that's really the beauty of the My Special Aflac Duck for the sickle cell patient or for the pediatric cancer patient, that somebody's with me, they're feeling what I'm feeling, and we're in this together. And we know that when you're treating diseases of this type, that emotional support is just as important to that little one as the very fine medical treatment that they're going to receive. So we have some great hopes that this little guy is going to be a tremendous help and support system to these children suffering from sickle cell.
Especially in the climate that we're in right now. They're limiting, Sawyer and Saxon used to go to their to Sawyer's appointments together all the time. And now, as like right now today, Sawyer's at Children's right now doing his appointments for after his post bone marrow transplant. Well, guess who he has with him, because Saxon can't go. He took Daxton, which is his duck. And Saxton hugged Daxton, told him that he was going to go with him instead. And so until he has Daxton with him at his hospital visits. So again, like I said, it just to back what Audrey is saying, it's again another way to let the kids know they're not alone. Even when their siblings who once was able to go with them to the appointments, now they're not able to go in the climate that we're all in right now. The duck is now able to go with them. So it's like, again, I can't speak enough about how it's helping, my own family in this situation.
Erin, thinking about the research that's going into adapting this for the sickle cell community, or what you've learned from the duck in the cancer community, what feedback and reactions have you had from caregivers or child life specialists or others who've been interacting with this tool?
Well, so one of the components that was really most powerful in the research was thinking about how we can bring these moments of comfort into the home, and how we can build coping skills and reinforce routines at times that aren't during pain crises and that aren't during moments of stress. And so what we actually designed is this really My Special Aflac Duck for sickle cell. And you can see there are so many features here that specifically meet the needs of these children. And I can maybe just show some of them and explain how they work and how they exactly translate to what we learned. The first of these is just a really cute little warming jacket. So we know how important it is to bundle up for those temperature changes. And at the same time, sometimes there's a stigma around it, wearing a jacket in class. And so to what Shay is saying, the duck is a friend that's just like them. It bundles up when they bundle up. And we also learned from child life professionals how powerful things like art therapy are for children, things that can take their mind off of what's going on. And so the really cool thing about this warming jacket is it's not just a jacket, it's actually also a canvas where children can draw with their water marker, just with water. And this works by just filling it up with water. And then as you draw, it disappears and lets you draw even more. And then really building on that notion that the duck is something that is just like them and experiences the same things, we also adapted the ways in which you give your duck treatment, because children with sickle cell disease don't always have a portacath. And so what we have here, and apologies for being a little fumbling, but you can attach this clip right here, and it allows you to give medication to your duck via IV. And so you can attach this right to your duck's wing, and now go through and give treatment to your duck in the same way that you're receiving treatment. And these are just a few of the things that we've designed specifically for sickle cell. One of the things that I can't exactly demonstrate here, but that's so powerful, is just reinforcing the routine. So through the app, you can hydrate your duck, you can give them their water bottle, you can give them medication, hydroxyurea, and even a heating pad, which can just be so comforting in those moments that are uncomfortable, that are painful.
Well, looking forward and thinking big picture, Audrey, what are some of the ways that you're measuring success in terms of these investments in so many ways into sickle cell? How is Aflac working to make that commitment sustainable over time?
Well, most importantly, we measure success by the number of healthcare professionals that'll be reaching out to make sure kids get these ducks. We want sickle cell patients to have this little duck in their hands. So I know there are approximately 11,000 ducks for pediatric cancer patients that are already out and circulating, being used by kids. We want the same for sickle cell patients. We want them to have their little buddy in big numbers. So that's absolutely one way that we're measuring success. Another is, again, just awareness of this disease and the trauma of it. I'll tell you something interesting, that when the company started formulating the plan to bring more awareness specifically to the sickle cell portion of AFLAC's commitment, I was very familiar with the disease. I grew up in an African-American neighborhood in Atlanta. I knew people with sickle cell. I even knew a family where all of the children had sickle cell. And this was in the 70s. And I knew the pain, the devastation, the crises, the hospital visits, everything back then when we didn't even have the things that Shay and her family could utilize now. It was a very, very tough disease. But what I found out in talking with team members here is, if you had not had a specific interaction with and awareness of sickle cell disease, you knew nothing about it. There were people who literally did not know and had never met anyone with sickle cell. And in the African-American community and communities of color, rare is the person that had never heard of it, had never met anybody. So bringing awareness to the overall population about the devastation of this disease that largely targets children. I mean, our most vulnerable citizens get the brunt end of this very painful and critical disease. So we want to make sure that people are aware. We want to make sure that funding continues, not just through AFLAC's commitment, but through other sources to help broaden the research and the treatment. And we also want to make sure that, the hospital continues to put a focus not just on the cancer portion, which is critical, but also the sickle cell portion. So in 2020, our annual donation to children's healthcare, the $1.5 million that AFLAC commits to as a baseline, went exclusively to sickle cell, to the sickle cell treatment. We want to make sure that no one is unaware of this disease, and that we continue with the research and the treatment developments that we've experienced.
That's what I want to shine a light on as well, because I created Sawyer Sickle Circle, and I don't know if you can see behind me, those are Sawyer's hands holding a full blood cell in a sickle hemoglobin. And then the circle basically is to join everybody that has helped us and anybody in the sickle cell community. I did that simply because I, as a parent, want to bridge the gap between the healthcare and us from the outside, because it can be very scary from the parent side to hear medical jargon, to hear from the insurance side, to not understand those things. The reason I created Sawyer Sickle Circle is to bridge that gap, to be able to sit down with families like myself, to be able to provide them and help them with assistance and information. So it won't be such a scary process. You don't know what you don't understand. It's about us having the knowledge. And when we have the knowledge, we have the power to be able to move forward. And that's what I want to do with Sawyer Sickle Circle. It's to not make it such a big fear, to be so afraid, to not be able to step back and not get the help that our children need. And that's what's important to me, for our community to be able to provide that assistance for the families that so desperately need it.
Great work.
We only have a few more minutes, and then we do have a deeper dive into education, research, understanding inequity, sickle cell. But a question for all of you, what are some of the kind of final words or challenges you'd give for clinicians, for caregivers, for parents, or just the general public that's a big question, and that's a lot of different groups, and some of them overlap. But Erin, do you have anything that you want to share with that audience?
Absolutely. So I think two. One is a hope, and one is appreciation and gratitude. So my hope is that our feathered friend here can be a little bit of an ambassador and help raise awareness, because as much as this duck stands out, it becomes a talking point to talk about what is sickle cell disease and why do we have it. And the moment of gratitude really is for you, Shay, and for your family, because everything that we've designed for children with sickle cell disease is only possible because of you, because of Sawyer, because of Saxton. And so from me, from our team, thank you so much for sharing your story with us and for enabling this work to happen.
Thank you. Thank you.
On those lines, I want to give out some thanks too for Aaron, who was partnered with us over 3 years ago and used his brilliance to help our duck transition from one very important type of pediatric patient to another. The work he has done through Sproutel with this duck has just been a blessing to so many, to Shay and to so many families that, we started AFLAC's commitment to the pediatric cancer and blood disorder services so that families like your beautiful family would receive exactly what you received. And so thank you for the trust that you put into the hospital. And thank you for being willing to share your story so that it might help support and uplift another family who may have to go through this. And to U.S. News for just the interest and the platform to share what's a critical problem. This chronic disease, we're making tremendous advancements in this space, but it can still be devastating to those who suffer from it. So thank you for the spotlight and the interest.
Yes. I'd like to say the same thing. I'd like to piggyback and say thank you. My tremendous gratitude to all here on the panel who are doing the work, who are putting in the work and the effort to sound the alarms. Me being a parent and also in the sickle cell community, I'd like to make a call to arms to the families who have a good story to tell, to please reach out. You'll find me and my family on the internet. Let's join together to create a larger circle and spread news and awareness. This isn't going anywhere until we make a call to do the work and put in the effort. We must speak up because we can help eradicate this disease, but we have to speak up. And I think we can get it done if we put in the effort and do the work.
That's well said, Shay. And I want to echo the thanks on behalf of U.S. News and on behalf of our audience to all three of you, Audrey, Aaron, Shay, for taking some time to talk and to truly demonstrate that this is a community challenge and it requires a community solutions. Thank you all for joining us, and we're going to now introduce our next segment, where we'll probe even deeper into some of these topics that you all have brought up. Thank you.
Thank you.
Thank you.
If you're just joining us, my name is Michael Morella, and I'm managing editor of events at U.S. News and World Report. Today, we're talking about sickle cell disease, and we're doing a deep dive into this condition and the future of it. We have with us now a panel, and with this group, we hope to dig deeper into the science behind sickle cell, as well as other efforts to care for those affected by it and to address health equity. I'm pleased to introduce Beverly Francis Gibson, President and CEO of the Sickle Cell Disease Association of America, Dr. Beatrice G., Interim Director of the Sickle Cell Program and Director of the Sickle Cell Comprehensive Pain Program at Children's Healthcare of Atlanta, as well as Associate Professor of Pediatrics at Emory Pediatric Institute. Also with us is Dr. Yasmin Tyler Hill, Professor and Chairperson of the Department of Pediatrics at Morehouse School of Medicine, as well as Medical Director for Children's Healthcare of Atlanta at Hughes Spalding. Welcome to all of you. Thanks for being with us. And now I'll turn it over to our moderator, U.S. News Executive Editor for News and Events, Morgan Felchner, to begin this discussion. Morgan?
Hi,
Hi, thank you so much for joining us today. I really look forward to breaking down some of the walls that we just heard about, learning a bit more about sickle cell disease and what's happening in the community to treat patients and what the future looks like. So why don't we start by learning a bit more about each of you. Beverly, can we start with you, and you can tell us a bit more about the scope of Sickle Cell Disease Association of America and its network across the country, and then we can kind of just go around the table and learn a bit more about each one of our panelists.
Wonderful. Thank you so much for having me. I am Beverly Francis Gibson. I am the president and CEO of the Sickle Cell Disease Association of America. And I am also a family member of a brother who is living with sickle cell disease currently. And I also have a cousin who died from sickle cell disease when I was in high school. The Sickle Cell Disease Association of America was established in 1971 to provide services and resources and information to families across the United States looking for resources and care. We have 53 chapters, and there are member organizations that provide advocacy, day-to-day services, support groups, and help really to educate families in their local communities.
Thank you. Dr. Tyler Hill, do you want to go next?
Well, thank you very much for inviting me to be on this panel. I serve as a chair of an academic department at Morehouse School of Medicine. Morehouse School of Medicine is known as one of the #1 institutions, medical institutions in social and social mission care. And so we really do the full gamut from making sure that we have a workforce that reflects and is well aware of sickle cell disease. We provide clinical care in the community, and we do bedside to community research around how to make sure that folks are getting the best care possible with sickle cell disease, and also advocacy and being in the community. Morehouse School of Medicine is one of 4 historically Black medical schools in the US, responsible for the training of the majority of physicians of color, African-American physicians and others. We also represent underrepresented minorities in medicine. And those are folks, when we think about, for instance, rural communities. For Georgia, who has 10% of the population of folks with sickle cell disease, many of those are not in cities where there is expansive healthcare, but they're out in rural communities. And we are very focused on that. We also want to make sure that our pediatric workforce is very well aware of sickle cell disease. And so in my role at Children's Healthcare of Atlanta at Hughes Spalding, we are one of the 3 hospitals within the Children's Healthcare group. And we provide care for almost 1/3 of the patients who they take care of with sickle cell disease. And we do that along with a primary care center and medical home. So it's very important for us, as we probably train around 25% of the pediatricians between Morehouse and Emory in the state of Georgia, that they are very well versed and know about sickle cell disease. So it's very important that Hughes Spalding in its work towards spreading the word. We know that there is lack of knowledge about this disease. And so that's where we come in to provide that.
Thank you. And Dr. G?
All right, thank you very much for inviting me. I'm really excited to be sharing this experience during Sickle Cell Awareness Month. So I'm currently the interim director of the AFLAC Sickle Cell Program at Children's Healthcare of Atlanta. And I've only been in this role for a couple of months, following on Dr. Peter Lane's work of 19 years leading up to where we are now. I was formerly a professor of pediatrics at Morehouse School of Medicine for over 20 years, where Dr. Tyler Hill was my boss. And at that time when I came was when we started, when Morehouse School of Medicine started having an interest in sickle cell, and we built on that for the last couple of decades. The AFLAC Sickle Cell Program at Children's Healthcare of Atlanta is the largest in the nation, with close to 2,000 active patients throughout metropolitan Atlanta and Columbus, Georgia. And I've been working as a pediatric hematologist, focusing mostly on sickle cell disease for most of the past 30 years. I currently see patients. I oversee the clinical operations of the 3 campuses in Columbus and also conduct research related to stroke and pain. But I don't do that alone. We have a very large group of providers, including physicians, nurse practitioners, nurses, social workers, educators, psychologists, case managers, and our office staff, who all work really hard together to help provide the best care possible to the kids living with sickle cell disease and their families.
So it sounds like we have the best of the best with us today. So I'm excited to really dig into it and work on that awareness piece. So feel free for anybody to jump in, but I'm wondering if you could tell us a bit about what the day-to-day experience looks like for someone with sickle cell disease, and help us understand and imagine the range of possible complications and comorbidities and things that come along with the disease.
Well, I think one of the things that, being a general pediatrician in the community, is that we see that sickle cell disease can impact each patient differently, each person differently, and each family differently. And so where we might have one child who spends quite a bit of time in pain and hospitalized and having the complications of multiple organs, there may be other children who are not as impacted by the physical everyday part of the disease. And so it's really important that our pediatricians recognize the patterns that occur with children at different levels with sickle cell disease, and are aware of that and experience that with seeing a large number of patients and families with sickle cell disease.
I would also like to add that a number of the patients and warriors that we work with across the country, in addition to pain complications, have had strokes. Many of them have had organ damage. They've had retina detachment. We've seen death. So young 20 and 30-year-olds who are dying needlessly from sickle cell disease in this country is another issue that I like to bring to the forefront. We have patients who refuse sometimes to go to the hospital, and they're trying on their own to deal with the pain at home. And as much as we try to encourage them to not do that, many of them prefer to at least try all means necessary to alleviate the pain on their own. One of the warriors that we work with describes the pain as having razor blades cutting through your bones, your cells, your body. And I cannot imagine even living that way every day. We have some patients who, according to research, also may not experience a lot of complications for months. And one day they wake up and they'll fine 1 minute, and then the very next minute they're not. So it really varies from person to person.
So let's talk a little bit. Oh, sorry, go ahead, Dr. G.
I wanted to echo that. What I had kind of thought about was that people can go from being fine when at the beginning of the day, and then feeling terrible at the end of the day, and possibly being in a life-threatening situation by the evening. So sickle cell disease is an unfortunately very unpredictable kind of situation. And I think it leads many families and people living with the condition to be kind of anxious and worried a lot. It's like, oh, is this, as the pain starts, is this going to be one of the really scary times when my life is in danger, or am I going to get over it by the end of the day? So that it really affects kind of how you can live your life in terms of planning ahead or even getting through the day. So I think that's something that can be very stressful. We try very hard to prioritize trying to live as normally as possible, but making sure that you're using your prescribed treatments and living a healthy lifestyle, just like everybody else. We recommend, healthy diet and activity and water and sleep and those kinds of things.
I also wanted to add, as a pediatrician, some of the things that we look at, the disruption, as Dr. B has talked about, of the life. And so that really impacts children for school. For instance, if you are sick and cannot attend school, we try to make sure that we keep up with the work with teachers on the campuses. but also knowing that we need to work with kids extra hard around those kinds of normalization of their lifestyles. And one of the things we did, for instance, on the Hughes Spalding campus, we started the college day when colleges came in and talked to children, because one of the things we see as children get older, and I know we'll probably talk about this a little later, as they become young adults, this disease becomes worse because of the social issues that are impacted by that. And so as a pediatrician, what our job is to make sure that children launch into successful adults. And so by encouraging schooling and college, it's another way of dealing with this disease, that we don't necessarily always deal with the pain, the infections, and the illness, but deal with their lives and socialization.
And I would like to echo that as well. Transition is a huge issue across the country from adolescent to adulthood. And we have a number of programs, a peer-to-peer mentoring program, for example, where we actually connect a young adult with an adolescent who is going through that transition period as a coach, as a buddy, as a friend, so that they also have someone to help them navigate all of the systems and changes in their lives.
So let's shift a little bit towards treatment. So we've heard about the disease, what's available to patients and individuals with SCD, and can you help us sort of understand what the options are?
Well, currently there are 4 therapies that have been approved by the FDA. And I know that there are several other therapies in the works. Gene therapy is an option. But again, for the community, there's still a lot of unknowns about gene therapy, the cost, what the follow-up is going to look like. Bone marrow transplant is another. And I'm sure Dr. G and Dr. Tyler Hale can also add some others.
Well, I'd like to ask you, Beverly, from your experience, what treatments are best accepted by families and patients?
Hydroxyurea is the most common one, and hydroxyurea has been on the market by itself for a very long time. So we literally had hydroxyurea for over 20 years, and it was the only approved therapy that families use. Now we have voxelotor, we have of course I'm going to blank on all the names now, but we have some other ones, Adagvio and some other ones that have come into the market. But we find that hydroxyurea still tends to be the go-to for families or for individuals living with sickle cell disease.
So I'll fill in a little bit on that. So hydroxyurea, as she said, has been around, actually first studied in the 1980s and then FDA approved for adults in 1998. And then for children, not until 2017, but we had been using it in children for most of the 2000s and 2010s. But it's a medication that helps increase something called fetal hemoglobin or hemoglobin F, and that helps prevent the formation of sickle cells. And when it works for someone, it helps improve their hemoglobin levels so they're less anemic and can reduce their sickle cell pain episodes and acute chest syndrome. But some people take it and it doesn't do much for them, or they find it difficult to take it. And then some people are just really hesitant to even try it because they're concerned about side effects, either potential for hair loss or just if we say your blood counts might drop, for them, that's kind of an unsafe situation, or that it might affect their future fertility. And that's one of, all of the medications that even if they might work, people are very concerned about the safety for themselves. Some of the newer medications that were FDA approved since 2017, one is called L-glutamine, or its trade name is Endari, and it's an amino acid that seems to help improve the survival of red cells by being what we call an antioxidant. It reduces damage internally to the cells. And people, the clinical trials about that have shown that people have some reduction in pain episodes and acute chest syndrome. Some of the others that she mentioned, voxelotor acts a little bit differently. It helps oxygen stay bound to the hemoglobin, and that helps also reduce the sickle cell polymer formation and the formation of sickle cells. In that case, that medicine works best to increase the hemoglobin, and slowly it looks like it might be helping to reduce pain. And that's taken orally. And lastly, the other new one is called Adakveo. It's an antibody that's made in a laboratory that helps block the sticking of white blood cells and platelets to the blood vessel, which might be a triggering event for pain crisis. So that one's a little bit different in that people have to come in for an intravenous infusion about once a month. And that one is for 16 and over, and it's to prevent pain crisis. So those are the newer things. And the problems with some of the newer medications is the cost. So far, Medicaid is paying for most of these new agents as well as hydroxyurea. However, private insurance doesn't pay for everything, and the copays can be quite expensive. So the pharmaceutical companies are helping out right now with patient support plans to help cover some of those out-of-pocket costs. Then I guess I should just be complete and say there's bone marrow transplant, where you can get cells from another person, usually a sibling in your family, to take over the production of blood cells in your body. And gene therapy is where your own cells some of your own stem cells are removed, and the genetic information within them is changed in order to either not have sickle cell anymore or to have additional either hemoglobins or genes expressed that help reduce the sickle cell severity. So those are kind of our main treatments right now.
And also to add, I just was on service this past weekend and took care of children with sickle cell disease. We also have our treatments that we do with pain, and pain management is a large one, and infection management. And so I don't want to forget that. And we are getting better and better at that. From the 35 years I've been doing this, our pain regimens have improved. However, they are not perfect. And obviously finding a cure for this disease is going to be important. And with that, and I would like to just bring up the collaboration that has occurred with the Georgia Research Alliance, Morehouse School of Medicine, Emory University School of Medicine, and Children's Healthcare of Atlanta, where all of us have invested in bringing on a program. And really the title is to find a cure for sickle cell disease. And we will do that across a spectrum of these organizations who have very strong bench research, like Dr. G does, to community-based research. And if anything we've learned in the last year and a half is that we can make a great medication, but getting it into patients is really what's important. That's what Beverly does. And that's what we are really expert in at Morehouse School of Medicine, and why the workforce and how we look at and expanding that workforce is going to be so important. So I think, we've talked about in both sessions on this webinar is bringing awareness to sickle cell disease and looking for a cure. And I think that when that is on the horizon, as we are doing here in the state of Georgia, with these three organizations and with the Georgia Research Alliance supporting us, and AFLAC being a part of that, we will be able to do that and really change the lives of patients with sickle cell disease. And I didn't answer personally in the beginning. We have C-trait in my family, and I only found out when my son was born in Massachusetts, and they were doing at that point 35 years ago testing. And now if we went back through my family history, my great-grandmother probably died from SC disease in childbirth because she would have these painful episodes that we sort of heard about historically. I come from a part of the United States, the Southeast, which has a high rate because of where the original folks were brought from Africa. So this is really something that is near and dear to me, to find this cure for sickle cell disease.
So we've heard a lot about some family connections and things like that. I think it's a good time for us to talk about services and things that are available for families of those with sickle cell disease. Are there examples from Children's Healthcare of Atlanta or elsewhere of what people can do for families and what services are available?
So since you asked about Children's Healthcare of Atlanta, I'll talk about what we have on site for our families. And we're very lucky, not a lot of other smaller centers don't have what we do, but through the philanthropic support of many donors, we have social workers at each of our campuses. We have psychologists for counseling and therapy, and we have child life therapy, and there are family support groups that are led by some parents. And that's all part of kind of what's localized at the hospital. We also work closely with our SCDAA chapter, the Sickle Cell Foundation of Georgia. And with them, we have partnerships through some funded grants for transition of young adults and adolescents. And also we work with them on patient-oriented activities such as Christmas parties and other things. And through education, trying to, we've hosted some of our sickle cell research summer program events at their location to kind of have the high school students who are learning sickle cell research have an opportunity to meet people with sickle cell disease and understand what their research is going towards.
I also wanted to share some of the, I will also, if it's okay, share some of the additional programs and offerings across the country that are offered by SCDAA, which is the Sickle Cell Disease Association. To Dr. G's comments, our Atlanta chapter is actually one of our larger chapters of the 53 that we have in the country. And many of them provide support groups, webinars, trainings, summer camps for families. We have brochures that have been created explaining what is a blood transfusion from the child as well as from the parent perspective. We also train community health workers and place them within the member organizations at the community level because they're actually seen as trusted individuals in the community. And I know we're going to talk about advocacy, but we had a big win this week on the Hill. So I'll wait and share that later.
And I just want to add that one of the things that was very important, Dr. G mentioned that she really built the program at Morehouse School of Medicine, and it was very important to continue that program. One, because of being at an HBCU, and we know some of the statistics about patient outcomes based on the physicians that treat them. And so it was very important to us to, for instance, bring on an African-American male hematologist to take care of patients. It was important for us to have that doctor go down to Columbus and move outside of the Mecca and take care of patients. Also, with community service, making sure that our physicians and our students, our residents, our learners would volunteer, for instance, at sickle cell camp. So bringing up that whole holistic sort of advocacy and community engagement with the disease process itself. So we add that. I also would like to add within our primary care, because remember, this is a disease that impacts not a large number of children, but also their families. And so we look at things, for instance, incorporating behavioral health within primary care. This is a social stressor. And I cannot tell you how the families, the kinds of social things that the families go through with this disease and helping them. And that's very important within the realm of pediatrics and taking care of the whole child.
Thank you.
I'd like to add one more thing about the advocacy and support is that there are many people, mostly adults with sickle cell, who don't have insurance coverage. And I think that it's really difficult for them to have a healthy life when they can't get the treatment. And we're going to need to kind of reach outside of community groups and to our governments to help people get the health care they need.
And that's some of the work that we've actually been doing with CMS, Medicaid and Medicare across the country. Also having conversations with federal and state government officials about what the needs are of sickle cell patients. We have a national sickle cell disease advocacy network that's comprised of patients, caregivers, advocates. And I think we have over 350 participants in that network. And so we're really trying to stretch, if you will, across all levels to ensure that advocacy on behalf of and with warriors and families and patients is happening on a consistent basis. But I will tell you, it is challenging. I will not lie, because every state has its own mandates and own protocols.
Well, Beverly, I'd just like to add, I now chair the pediatric section of the NMA. And so definitely that's on our agenda for our meeting next year, and with work we're also doing with the AAP. So please keep us in mind with that. I just wanted to give that shout out if I don't get to see you another time.
Yeah, definitely. I'd love to chat.
So I'd love to dig in a bit more to taking a community health approach to sickle cell disease, since we've touched on that a bit. There are large systems and cities that work together to make an impact. The Morehouse, Emory, Atlanta, Children's Healthcare of Atlanta is an example of that. Can you tell us a bit more about that, and how can others replicate that approach to make a difference?
I guess I'll get started. So when I came to Atlanta, I was able to get a job at Morehouse School of Medicine, and Emory and the other hospitals didn't have any openings. But seeing that the sickle cell program was then staffed by Emory University, I needed to get into the practice in some way. And Grady Hospital at that time had kind of separate services for each medical school, but that did not seem like a very effective approach to taking care of a large group of patients. So starting at that back in 1998, which we chose to take on kind of an approach that was more teamwork oriented, to take advantage of the expertise that was in town and to kind of share the practice. And I think that's kind of the beginning of the Morehouse and Emory relationship. And then Children's Healthcare joined later in 1998, and they took over the pediatric care, but needed to partner with Grady Hospital still for adult services. So we were kind of, as the landscape of Atlanta was changing, we needed to be adaptive and kind of make it work across all of the agencies, because the expertise was available at all different places, and it didn't make sense to divide it up and not work together.
So I want to just sort of piggyback on what Dr. G said, and what that takes is leadership with a vision that understands what needs to happen. So it's an intersection, and this is why a diverse team is so important in bringing to this disease. I think looking at it from the perspective of how do we take care of the children, and putting that together and understanding the strengths of each of the organizations that comes. There is no better healthcare system than Children's Healthcare of Atlanta for providing care and services. And I think that's their expertise and quality of care. And Emory, known for its great bench research, and Morehouse School of Medicine emerging in that area. But in community engagement and social network and trust in the community, there was Morehouse School of Medicine. So we were able to bring together, and looking at a problem of curing a genetic disease, bringing these three groups together. And I think the leaders of the Georgia Research Alliance saw this and invested in this, and we hope that there will be others that invest in this work. And so I think that it is that vision, that leadership, that wanting to make a difference, and seeing the importance of that is what gets it going, and collaboration. And I'd just like to say that reaching out to my counterpart at Emory, Dr. Lucky Jane, who is the chair of the Department of Pediatric, Doug Graham, Clint Joyner, B, who really sort of in the background pushed this through, and has really made a difference in how we, our culture of looking at this as a disease process. I don't think you can underestimate that. So it's basically the leaders with a commitment to get this done.
So the top-notch care is definitely out there, but I wonder what you do in underserved communities in rural areas where people can't necessarily get to Atlanta or another world-class institution.
Well, I think that's what we are, and I'm very I want to address. I grew up in a town with one stoplight in rural South Carolina, so I understand from the experience of just not having the same level of care. So for us at Morehouse School of Medicine, we actually have the only pediatric residency program in a historically Black medical school. It's very important for us to train the next leaders in healthcare so that they understand underrepresented minorities is what we work on. And those are rural doctors who will learn whether they are white or Black or any other ethnicity. So they will understand sickle cell disease. And so providing them with that, at least the basic level of primary care who understands this disease. And then we have a network of being able to refer into Children's Healthcare of Atlanta. You know, we try to take care of what we can at home, but for any problem, medical problem in most of our states, we have a centralized care. So it's being able to spread the news of what needs to be out in the community, sort of as a spoke and wheel kind of a thing. And then having that center where the expert care, that sort of very, very high level of care for the very small number of kids who will need that. But yes, that's the model that we would look at now to be able to provide care equitably.
So we have some outreach. As Dr. Tyler Hill mentioned, we have a clinic in Columbus, which is staffed by Dr. Payne from Morehouse School of Medicine and a number of other physicians from Emory. And it's once a month. We can't be there as often as we'd like. But we think it's really important to serve some of the needs there. Our clinic is supported by the Kuhn family, which is a local family from Columbus, as well as the Aflac Corporation, whose headquarters is in Columbus. In the state of Georgia, the Department of Public Health partners with the Augusta University, the other major medical school in the state, and they have outreach clinics where they actually have a van and they go to certain cities in the rural part of the state at different times of the month, and they will see patients in health centers there. But I don't think that's a model that's available in many states. So I think it's going to be a challenge to reach out to rural communities. And my vision for that is to continue to try to train primary care providers to become at least feeling comfortable and somewhat skilled at taking care of sickle cell disease. And I'm planning to work with the internal medicine and family medicine residency programs at both Emory and Morehouse School of Medicine to develop some training programs where they can shadow us in both pediatric and adolescent clinics, as well as the young adult patient population at Grady Hospital, to help them kind of become comfortable so that when they're in private practice or in their primary care practices, that they feel like they can manage certain, kind of fairly uncomplicated sickle cell disease. Because I think we're never going to get enough hematologists who are interested in sickle cell disease to treat as many people as we have. And we need to branch out and help other healthcare providers, such as nurse practitioners and physician assistants as well, to feel comfortable managing some of it.
But we hope with having people like Dr. Payne and bringing on additional researchers that we at Morehouse School of Medicine can interest some more learners in sickle cell disease. So that's part of what our goal is, to make sure that we have the right workforce. That is what is in terms of developing equity around this. Absolutely.
We likely have a lot of hospital leaders in our audience. If there was one thing that you could tell them, what would it be? What would you suggest for treating sickle cell disease, and what should they know?
I think that it's to realize that that historical structure within our healthcare system has not been, promoting the best care for people with sickle cell. And I would look at the management of pain, for instance, which is a hallmark of sickle cell disease, and the disparity we have in how we treat African-American children with pain versus others. And to realize and to really look at your infrastructure, look at how that is built, and does it promote an equitable system of care that all would be welcome. I will tell you the story. One of my best friend, my neighbor, has sickle cell disease. She's a physician. Her husband's an anesthesiologist, and she had a pain crisis. And I went to the hospital, left work. Took me about an hour and a half to get there. And I got to the hospital where she was, and she's still not gotten any pain medication. And I think there was steam coming out of my ears, and her husband was like, no, don't do that. I don't want to. And I'm like, this is where feathers need to be ruffled. That was her experience. And this is a pretty resourced individual. We have to look at those kinds of systems and make sure that we break down those barriers. I'd taken care of a family this weekend. The mother said to me, a 17-year-old child that we know very well in our practice, that my biggest fear is when she is no longer able to use the pediatric services. So again, advocating around that. So I think looking at those are the two things I would leave with the leaders and systems.
Yeah, I would echo that as well. I have patients who email me, text me, indicating that they're being escorted out by police when they go to the ER for help and for care. And in 2021, that should not be the case. I would ask that people treat other people the way they would want to be treated, and that you shouldn't have to dress up or look a certain way to get the care that you need when you go seeking that care at any of our medical institutions across the United States.
This brings us to something that I had on my list to talk about, but I think it's time to dive a bit more into it. Let's talk about health equity and the situation with sickle cell disease, and what can be done about it? How do we solve some of these problems and make sure that we're giving more equitable care to everyone?
I think that's, the examples given by Dr. Tyler Hill and Beverly are the main ones. It's like, it's not every hospital's responsibility to have a comprehensive sickle cell center, but every hospital can try to address the way they treat people of color and to address the racial belief systems that their healthcare providers have. And the pain issue is one, but just also just kind of how people are respected or not when they are in the hospital. So even unfortunately in pediatric care, we can have some people who are experiencing pain and said to be having family troubles as opposed to actually having sickle cell pain because they are a Black person, and maybe they don't have as kind of a traditional family structure as others. So I think that addressing kind of general racist systemic racism is going to be one of the most important things that helps people with sickle cell disease. Some other areas of disparity have to do with insurance coverage and not being able to get care. I mentioned that earlier. But in our bone marrow transplant experience, we have the largest transplant experience in the nation as well for sickle cell disease. But it's been found that those people with sickle cell disease who have Medicaid insurance rather than private insurance are less likely to be cured by transplant. And when they do go to transplant, they have more complications and not as good outcomes. And that suggests to me that lower socioeconomic status causes kind of deep-seated health problems that make even curative therapy not as good for some people as others.
Yeah, I would echo something that Shay said in the first session, and is that we try to encourage families and patients to share their story, to humanize it, because I think sometimes even when we're dealing with government and they're looking at numbers and they're looking at money, they fail to look at the people who are impacted behind those numbers. And we try to encourage our patients and our caregivers when we go to the Hill every year for Advocacy Day to share their stories and to share what it looks like and feels like to live with sickle cell disease. And we have found that even some of the legislators who we're working with know about sickle cell because they have it in their families. So sometimes it's just that reminder of what's happening at the ground level, on the street level, if you will, that people who are in power or people who are in leadership positions need to be reminded of. And one of the things I have to say before we close today is this week, we were able to get the Sickle Cell Disease Caucus relaunched in Washington, D.C. And that's with the House and the Senate both coming and saying this is important and we want to stand behind sickle cell patients to make changes happen at the federal level. So I wanted your listeners to know that we are working at all levels, but at the federal level where people are making decisions that impact people's lives, they have got to have a stake in the ground. And we have asked for that and they have come forth and said yes.
So this is a nice opportunity. Oh, sorry, go ahead, Dr. G.
I was going to say, somewhat surprisingly, the Sickle Cell Care Act was approved during Richard Nixon's administration, if you can believe that. But it kind of became outdated and expired. So this is very good news that you're saying today.
Thank you.
So Beverly, I promised you would get to advocacy, and you brought up your point, I think, already, but I want to talk a little bit more about it. What can be done to build greater awareness around sickle cell disease and to help take action to help those that are affected by it? I mean, I know it's September is Sickle Cell Awareness Month, but what can be done to highlight that and carry that through the rest of the year?
Yes, I appreciate that. Sickle Cell Awareness Month was designated by Congress as as September as Sickle Cell Awareness Month to not only raise awareness, but to also raise awareness about the need for more research and clinical trials. And I think more than anything else, if we can help patients navigate our medical systems and our general institutions to find help, that would be one thing. We hear so many times that once a child is diagnosed with sickle cell disease, it sometimes takes up to 4 years before the family stumbles into help and or to care or to finding the right resources. So I think advocacy is obviously number one for me, and raising awareness is number two, or actually they go hand in hand. Because even when I was appointed in my position in 2018, there were people who were surprised that sickle cell disease is even an issue, still an issue. And I think it had gone dormant based on what Dr. G just said after the Nixon administration. But I think we have been trying to do is to encourage families to be a part of a larger network, because it's hard if you're trying to do it by yourself. And I always say we can't do it by ourselves, and nor do we want to. So we have to work hand in hand with academic centers and medical institutions and government and civic organizations and lay individuals who are like, I have nowhere to go, I know no one, and I feel like I'm all alone in this. And we have to let them know that you're not, and that there are a group of people and there are organizations working around the clock every day on your behalf, and you can be a part of that. You can volunteer. There are people who show up, and I even had a lady who emailed me today and said, I just want to be a part of whatever you're doing and share my story. And I said, yes. So we're actually gearing up for our 49th annual convention, October 12th to the 16th. It's the largest patient advocacy convention in the United States. And patients from around the world are participating, sharing their stories about what it's like to live with sickle cell disease. We're going to talk about some of the current therapies, what's happening globally, what are some of the corporate leaders saying about sickle cell disease, and we're asking them to put their stake in the ground and make not just a verbal commitment, but to make a monetary commitment to helping change what is dire for so many people.
And are there specific things you'd like to see from the business community, the healthcare community, government, and other stakeholders to make a difference?
Definitely. Obviously, legislation, we find that there are a lot of things that are stopped because of legislation. To Dr. G and Dr. Tyler Hill's point, we need to deal with systemic and institutional racism, and we need to talk about it, because if we keep pushing it under the rug and assuming someone else is going to deal with it, it's never going to be dealt with. And so we need to have those honest conversations. We have to be willing to reach across the aisles, reach across the road, reach across neighborhoods, if you will, to work together in order to impact sickle cell disease. There are 100,000 people living with sickle cell disease in the United States, and that's literally not the largest disease state that we know of, but it's the one that gets the least attention.
I just want to say, if we look at an organization like AFLAC, who has obviously put their money, and we haven't said the word money, but we know that we invest our resources in things that are important. And so I think looking at that, so obviously dollars around research and research, again, from the bench to the bedside. Let us not forget the lesson we've learned about just having therapies, but how do we have therapies that work for the individuals that they are meant for? So I want to say that. So I think AFLAC leads in that, and I think that our duck friend and the AFLAC duck will be, I now look at him differently on TV. I never noticed before until recently, but I think that that's important. Making awareness, and especially with children, that this, and taking the disease out of all of the other baggage that we bring, the crosshairs in this country around race and socioeconomics and poverty and all of those things. I think this is admirable. And diverse teams. I think bringing together a diversity of thoughts and ideas, and obviously you see AFLAC leads in that, and that's what I think will really make a difference with this disease process.
Dr. Tyler Hill, you mentioned your friend's case where she hadn't received pain medication by the time you got there, and those stories are coming out, which is important that that we're hearing about these stories time and time again, and too often. What do you see? What's the next step? What do we do, and how do we fix that systemic racism that's really
Oh gosh, that would take another webinar, and we can go there. But I think that it is. I'm one that believes in relationships, and sort of grassroots relationship. We can, and if we look at the basis, and there's now a whole science that's looking at racism and implicit bias within healthcare, and why, or within how we live, and how that comes up. And so really a deeper dive into how do we overcome some of these very natural, instinctive things that we have. I sort of make an analogy that I would love to be a great tennis player, and I could play 1,000 hours a week if that were possible. But I need to work on it little by little, and I will get better. We need to be aware that there is an issue with implicit bias, and we need to bring that up. We all have these biases. It's not picking about race. Remember, race is a social construct, and that is it. And so being able to bring that into healthcare, and we are now having chief diversity and equity and anti-racism curriculums that are put into organizations. That's very important to really look at that and bring that to bear, and having these honest conversations and relationships, not pointing blame, but saying, what do we want our outcome to be? I mean, I could go on and on about this, and this is a new science that is really coming up as we look at healthcare and how we get the outcomes that we want.
I want to give some examples of organizations that are not traditionally oriented towards sickle cell disease, but have shown interest. And so there are some churches and community groups that have health ministries. And one of them locally did a webinar together with the local Atlanta Red Cross to help bring attention to the need for blood donation from the African American community. And that's relevant because there are proteins on the surface of the red blood cell that are determined by our ethnic ancestry. And so people who have sickle cell disease who have African ancestry are more likely to accept and not reject blood cells from people of similar ethnicity. So it sounds like, oh, Black people need Black people's blood, but there is some truth to that. And so, and these are just kind of their own ideas. I've had Girl Scouts reach out and say, can you come and talk about this and educate us? And I need it for my badge. But in any case, it's I think there are a lot of groups that could be helping if they're interested. And so we encourage them to. I think some of the stories that have been told are really important. And if we had people like Michael J. Fox, who is kind of the face for Parkinson's disease now, who felt comfortable, celebrities who felt comfortable sharing their story, it attracts a lot of positive attention. It gets people interested in the condition. And I think this event and like the New York Times, they've had a series of many sickle cell articles this year, and that's new for them. And it's really important for sharing the story and getting the news out.
So I want to just give everybody the opportunity to say their final word. What's the last thing that you want people to know, and what do you want to leave people with about sickle cell disease? Dr. Tyler Hill, would you like to start?
I can go ahead and start. This impacts over 100,000 people in this country, 10% of which live in the state of Georgia. It disproportionately impacts children during that sort of critical time. One of the patients I had this weekend was a 8-month-old with dactylitis and pain and acute chest syndrome. And so, we really do need to bring to bear knowledge about this disease and more awareness to bring in more funding and more folks interested in treatment and research around the disease process.
Dr. G?
I want to say that I'm really excited about the Cure Sickle Cell Initiative from NIH and how there's a lot of resources going towards cure, but there are going to be some very important questions in terms of how do we make it available to everyone who needs it, because it's going to be very, very expensive. And in the meantime, for all the other people who haven't been cured yet, we need to maintain our dedication and resource commitment to treating the sickle cell disease they have now, and not only looking towards the cure.
Thank you so much to all of the panelists today. It's been a wonderful discussion. And thank you to the attendees. And thanks, everybody. It's been a great webinar.
Thank you.
Thank you, Morgan.
Thank you.